I want to talk to you about chronic pain. Now, chronic pain for me is one of my greatest passions to treat, because when someone comes into me with chronic pain, it means that they've been in pain for at least 3 months, sometimes years, decades, and they want me or another member of the staff to get them pain-free. And it's an amazing process because you get to see them make an amazing transformation. However, I had a patient earlier, it was yesterday, and they mentioned something to me, or they said something to me, which I've heard quite a few times, which is, I'm a really difficult case. No one's been able to fix my injury. I bet you can't fix my injury, which is quite interesting to me, because you're essentially you're wagering against an outcome which would actually be quite beneficial to you. And there are plenty of reasons why this occurs psychologically. The process which is essentially happening is that patient is saying, this isn't my problem, it's yours now. No one's been able to fix it. This is a problem for you to solve. And the reason why is because it means that they can surrender control. It means that they don't then have to be responsible for an injury, which is actually quite relieving for a lot of people. If you've got an issue and you can then take that issue and pay to put it in someone else's hands, that's actually quite empowering for that patient, whether they're suffering from mental illness, whether they're suffering from pain, or if it's a client who is overweight and they can't lose, and they find it very difficult to lose weight. It's quite empowering for that individual to then say, okay, cool, it's not my issue anymore, it's yours. Now, sometimes this works. Sometimes that empowerment, or sometimes the belief that they're actually doing something, or that someone's actually doing something for them, is enough. But a lot of times it's not. And the question is, when they do come into this place with this kind of belief system, what do we do about it? Now, the only option, if that patient doesn't respond to passive treatment or passive intervention, which would be manipulation, massage, etc., is you have to empower them. We have to empower you. We have to show you how pain is a challenge which you can conquer, and we have to give you step by steps, baby steps, to take you from where you were to where you want to be. Because the truth is that pain actually has very, very, very little correlation to structurally what's going on. You could have a very degenerative spine, you could even have a fracture, you could have a torn muscle and be in very, very little pain. But then an individual who doesn't have any structural damage could be in an astronomical amount of pain. And the reason why is that your pain systems and your anatomical systems are completely separate. They've got very, very little to do with each other. In fact, pain tends to kick in before you've got any structural damage whatsoever. And that's really beneficial, because you don't want to do something until you break it for it then to become painful. You want that pain to kick in as soon as your body is aware that it's being put through stress, which it doesn't think is very good for you. So just like your eyesight isn't actually vision until your brain interprets the information that it's getting from light bouncing off the back of your retina, pain is exactly the same thing. Pain does not exist until your brain creates an image of what's going on and a perception of what's going on. And that means that it is heavily, heavily influenced by many different things. At the Revitalised Clinic and any evidence-based practitioner, they will use what is called the biopsychosocial model, which means that you take into consideration biology, what's going on, i.e. is there inflammation, is that muscle weak, is it strained? Then you've got the social, what does that individual, how does this injury fit into that person's life? Is it stopping them from working? Is it stopping them from having fun and doing things that they really enjoy? And then you've got the psychology of it. How does that individual perceive what's going on? And all of these are very, very important, some more important than others depending on the patient, but we have to be able to tackle it. So this patient came into me and he said, well, this is your problem now, please fix it. And I said to him, no, I'm sorry, but this is your challenge. This is your challenge. I said, I'm going to see another 10 people today. They're all going to be pain-free within the next, say, 3 to 5 weeks if they work well with me. So whether or not you get the outcome that you want has more of an impact on you rather than me, and you have to view it that way. The issue is that because of allopathic medicine, so traditional medicine, we have this philosophy of medicine, which is that if you have a disease, then you need some type of medicine or someone else or some professional to go in there and take the disease out. But in reality, we are very, very complex human beings when it comes to sensation, when it comes to how we feel, whether that's pain, depression, anxiety, etc. These can be heavily influenced by not just physiologically what's going on, so not just the disease, but also psychologically and socially what's going on. I'll give you an example. When it comes to pain, the biggest predispositions for pain are depression, sleep deprivation, and a bad lifestyle, so poor diet and lack of exercise. The more that individual gets closer to eating well, living well, sleeping well, exercising well, and thinking well, the closer they are to getting pain-free, fit, healthy, losing weight, being mentally well. We are very, very complex as individuals, and we have to acknowledge that. If we take a very reductionist approach to our health, that might be that you go on a particularly restrictive diet, you think an osteopath or chiropractor is going to manipulate that joint back to how it should be again. If you think that by purely just taking antidepressants, or by avoiding the situations that present harm to you, whether that is mentally or whether that is physically, you will just dig yourself into a hole that will be very, very difficult to get out of, and a lot of the time you'll be very disappointed. The more responsible we are for the issues that we're bringing to the table, the more responsible that we are for our own setbacks and our own pain and our own problems, the quicker that will be pain-free and mentally well and fit and healthy and productive individuals. And obviously, if you need any help in making your way and becoming that individual that you want to be, whether it's pain-free, mentally well, socially well, physiologically well, then all you need to do is contact myself or any other team member at the Revised Eyes Health and Fitness Clinic, and we will be happy to help you with a free consultation. Thanks for watching.